Right, now for the second half of public health, we have the concept of new public health. This basically relates to expanding the traditional focus on individual behaviour change, and it's more talking about at a population level, the physical, socio-cultural and political environments impacting health. Right, so some examples are, it's mainly relating to health promotion, by the way. So health promotion is the main thing that is being focused on in new public health. These include road safety education programs, laws about smoking indoors, food labelling initiatives, laws limiting alcohol marketing, taxing sugary drinks. Alright, so the government has played a huge part in this in terms of creating laws, implementing programs, funding them, and other organisations as well, right? And it's all about ensuring that there's less friction to make good choices, okay? And this became more of a focus once our infectious diseases got reduced, but our non-communicable diseases increased, okay? So once cardiovascular disease, once our lung cancers and our cancers in general, once all of those sort of diseases started to increase and become leading causes of death, the government was like, okay, look, keep our old public health model in place to reduce infectious diseases, but we're going to also start addressing lifestyle factors through health promotion under this model of new public health. Okay, and yeah, really important that you know one or two of these examples so that you could say this is how it's linked to health promotion and new public health. Alrighty. So we have another practice question from VCAR 2018. It's a 3-mark question. Okay, so it's one of the first exams for this study design. And it's basically saying, analyse one way in which new public health may have contributed to improvements in Australia's life expectancy over time. Okay, when you're analysing, you're providing a bit more detail than when you explain. Okay, so the mark allocation for this is basically one example of new public health. You have to have an example, whereas you probably wouldn't get the marks. 2, an in-depth analysis, and 3, link it to life expectancy improvement. Okay, so a sample answer that I've provided is, okay, one strategy of new public health is to focus on the prevention of disease rather than the treatment, such as by educating and improving health literacy, right? One example of this is the Sun Smart campaign implemented to raise awareness about the risks of UV exposure and how to reduce it by wearing sunscreen. Okay, and yeah, a lot of you guys would be familiar with that because most of us were educated about this in our schools under this model. This can reduce the risk of skin cancer and thus improve Australia's life expectancy over time. One example of a high scoring response from the exam report is this one, and this one is a really good example in terms of really linking it to health status improvements. And as you can see here, students who chose like an example were more able to discuss it and link it to improvements in life expectancy over time, right? So people who chose a health campaign like SunSmart or Road Safety or Quit smoking, and Quit Victoria, were actually able to better answer this question than if you just sort of rambled on about new public health improving health. Okay, you need to be really specific in your answer because HHD is all about specificity, conciseness, and formality. Okay, so in this case, the first sentence of the answer is talking about how one being through health promotion campaigns, and then it underlines this idea of promoting healthy behaviours and educating people on the effects of unhealthy behaviours such as smoking. This improves health literacy and empowers them to take control of their own health. By knowing the adverse effects of smoking, people are less likely to smoke, right? This reduces the prevalence of CVD and improves life expectancy. So it's a really good example in that it draws on a range of examples and then it really narrows in on that one example and how it improves life expectancy over time. If your answer didn't have improving life expectancy, you might not have gotten the marks because you didn't actually link it or answer the question. The other thing I want you to note is only 58% got 0 marks. okay? Only 10% got the full marks. So these sort of questions, it's very easy to lose marks by things like not being specific enough and not like actually answering the question, which is very clear, and it's about analysing improvements, right, through like an example of new public health promotion campaign.